Recently, I was treating a case of autism. The parents were very perplexed because the child wouldn't sit or calm down. The child was extremely irritable, and even after giving what the child wants, the child stays calm for some time, and again the child gets very irritable. So this was causing a lot of problems, not only in therapies but also in school, because nobody knew how to calm him down. So they came to us, and we were taking the case, and we were asking what are the symptoms, and that they were narrating the history. And the parents were saying that he's extremely irritable and doesn't sit in one place, constantly crying, whining, and nothing can calm him down. Even if we give him what he wants, he's calm for some time. Again, the whole thing starts again. And the mother said the only thing that can help the child is when we carry the child and pet him and carry him in this room, he will calm down for that moment. The moment you keep him down, he again starts getting aggravated. So this symptom of carrying the child when he is irritable, and which helps, is very important in prescribing the homeopathic medicine. So when we refer to our books, like in this case, when we refer to Boric, the pocket book of homeopathy, there is a very clear-cut description of chamomilla, the remedy which comes. This is not a PQRS prescription, but taking the whole case into consideration, we selected the acute remedy as chamomilla, where it is mentioned the child is extremely irritable and wants to be carried, and that calms him down. Even if you give what the child wants, then also the child will be quiet for some time. So clearly it mentions whining, restlessness. Child wants many things which he refuses again. Piteous moaning because he cannot have what he wants. Child can only be quieted when carried about and patted constantly. Impatient, intolerant to being spoken to, or spiteful. Interrupted, extremely sensitive to every pain, always complaining. So this is very the symptom amelioration on carrying is very important when we come to a conclusion of a remedy. So when you go to your homeopath, tell all the symptoms. Don't think that this is not important, that is not important, because while prescribing a remedy, these symptoms are very important. So there are two aspects. One is the symptoms which are necessary to diagnose the disease or disorder, and the other is the prescriptive one. So these PQRS symptoms are very important. So that's why homeopathy is like a personal medicine which is customized for each and every patient. So when you go to a homeopath, and if he starts asking questions which you think irrelevant, please be assured that there is some importance when your homeopath is asking these symptoms. So don't take it lightly. Understand how the science works, at least the basics. And if you're not sure, ask your homeopath. We have seen in the past 23 years of our practice, we have seen wonderful results with homeopathy. And in the area of autism, we have seen some fantastic results where we were able to help the kids to settle down, improve their cognition, help them in development of speech, help them in behavioral issues, sensory issues. Teenagers with autism, adults with autism come to us for behavioral disorders or behavioral issues that they are facing. So homeopathy can be an important aspect of treatment when it comes down to autism or any other disease. So when you go to your homeopath, be clear in what you're saying. If you're not sure, write down your case history and give it to the doctor or the homeopath. So you are in a better position to get a desired result. Thank you very much.